Assalamualaikum warahmatullahi wabarakatuh. Dear all the participants of 4th International Conference on Veterinary Medicine and Health Science. My name is Fatah Nugroho. I'm the representative of my team, supervised by Professor Dr. Sudarmanto Indah Julianto from Faculty of Veterinary Medicine, Universitas Gadjah Mada. In this occasion, we will report a clinical and pathological investigation of Feline Panleukopenia cats with respiratory signs. The background of this study is because Feline Panleukopenia disease commonly seen in cats and highly contagious and fatal. It caused by Feline Panleukopenia virus from Parvoviridae family and affects mainly in young cats. It also leads to secondary infection of bacterial, viral, or fungal because of the virus characteristics that replicates in lymphoid systems and decrease the immune systems. This results on wide range of clinical signs, not only in acute condition, high fever, weakness, anorexia, vomiting, and diarrhea, but also affects another organ system such as respiratory, and it affects the diagnostic and also the therapy of this disease remain challenge. In this study, we investigate clinical and pathological outcomes, focusing on Feline Panleukopenia cases with respiratory systems to uncover specific complications and manifestations that happen in this case. The benefits of this study, we could provide insights into disease progressions and severity, identifies alterations in disease presentations with respiratory signs, and also become a basis for the treatment plans with this case. The subjects of this study are two Persian cats that assigned to UGM Veterinary Medicine and Animal Clinic at March 2024. The clinical signs as follows, and we do further examination of hematology and rapid antigen tests to establish the Feline Panleukopenia diagnosis. Then we plan the treatment, but unfortunately, the cats were dead, and we seek for the permission for necropsy and using them as the sample for this study. The clinical examination results show that the fever only happened in one cat, and while the others clinically normal. The base diarrhea also happened only in one cat. So for the primary treatments, we give fluid therapy, double kinds of antibiotics, enofloxacin and amoxicillin, azovigostim, and hematodin for the supportive. The hematology results show that the notably leukopenia and hyperfibrinogemia only happen in one cat, while the others develop the same condition in the third day of the treatment. The pathological findings show mainly in 4 organs, that is intestines, spleen, lungs, and also heart. The mucosa layer of the duodenum showed hyperemia with mucus watery content. And the histopathology reveals that there were deformed villi and crypt deformation and necrosis. Meanwhile, in the spleen, there were swollen. It was swollen, indicated by the blunt edges, and the histopathology saw expand of the white pulp and also a congestion in the red pulp. The lungs and heart showed multifocal hyperemia with significant amount of yellowish fatty plaque in the heart. The histopathology of lungs showed there are edema with the inflammatory cells infiltration at the septa. The lungs also showed visible spaces between the myocardium, indicating atrophy of myofibers or cardiomyopathy. These results show no direct evidence of feline panleukopenia in affecting the lungs. Secondary infections, another also cardiomyopathy, or because of the symptoms happen before the feline panleukopenia symptoms, might the reason of the respiratory signs appear as the predisposition of the Panleukopenia disease. Thus, the conclusions of this study, we found that clinical presentation of FP was complex, which includes many organ systems. The respiratory signs were not related to viral infection, but as a result of secondary problems or disease progressions. Also, pathological results had contributed to establish the disease severity and might be a basis of better understanding of the disease characteristics. That's all from me. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.